easier. Okay.
And they also feel say, oh, they won't come and sit down and wait. Say time no 2:30 2:30 na yes, and everything. Okay. They will come and wait and then maybe pick something in her facility, for example. Yeah. So telemedicine. I learned the software how to be able to do it.
Yeah.
The other thing now we also learned is that your health sector no. You see your name, your mind, and everything.
Yeah.
But it taught us a lesson. Say baby start here. Say to ye was na ye hwehwem very well. Once COVID start here no. Na your name say COVID no. No ebe to me create clots. What nipa ye name say na nipa lungs no to me sisano if you taking oxygen no and to me in co nipa duanu say na say it took us time to know these things. That time no na bi no mo some of them died already.
So the clotting issue now, it became something on social media that COVID vaccines caused. No? Do you agree to that? Was it really true?
Okay.
Because all along all along we were, and I say you want to say just one and those conspiracy theories, and I say but you just mentioned it.
I'll talk about it.
Okay.
What I'm talking about is the disease itself.
Is it okay?
Not the side effect of the clotting.
Okay.
It's the disease itself.
Okay.
It's the disease itself. Say, Jumai was hospital, less in that, yes, and say, pandemic be a bar. Say, we should not be stubborn scientists.
Okay.
I drink just one idea, Juma. Say, and take care of knowing everything about it as we get along. Because now I'm preparing for surprises. So as hospital people know, that is very, very important. Then another lesson which is the most important, and only one, mental health.
Okay.
Who say when you are in isolation, don't say we have not been created to be isolated people. I will with them for how many hours? But during the pandemic, no. How that affects
mental health.
And now, Emma, across the world, no, we've taken mental health a bit more seriously. Say, Senya, you bet to me, making sure.
But Dr. did we really look at how COVID-19 had impact on our mental health? I think there was not much attention paid on that side.
Exactly.
Because there was so much depression going on during that time.
Exactly.
But the focus was all on COVID-19 vaccination.
Yes. But later on, you say no. I say, nipa, we take care of mental health.
Okay.
So when we say na ebinomu airbo music and playing it to the listeners, we decided say you see gadgets ni nyama
during those times on TikTok be one of the
exactly. And so yes, I say nipa ni mental health is very, very important because you say nipa no one of your most valued living assets no ne wajin as your mind and now your emotions. And see, mental health, my young say mental health is very, very important. The BIA one, you say, is it okay in the mental area? Then another thing I how are leaders across the world through pandemic and now assembly is affecting the entire country. Nia leader no bejeno. Senior or carry him or herself. Obey that you lead the population is very important.
Okay.
Because leaders are influencers. And he will say countries are now leaders no far science taking decisions no problem.
Okay.
Me person me boy. Problem baby. But Ghana Hanumo, I can say President His Excellency Nana Addo Dankwa Akufo-Addo. He did well.
Yeah.
Ni senya okasaye ye common phrase bi I use the development community say or see ye wo nimdia ye betumi restore the economy. Say bibi anko ye ti say nyama senya ye say ye ho adwuma. But say obi wo a untumi
and bring it back the person.
That coming from the leader no ekanya obi a me cry ekanya me as somebody a me ye adwuma. You know, we are making sure say vaccines will, you know. So leadership is important. And say ye nya pandemic bibia. And say ye leaders are they are talking
and for him to cry to get a gap first, you know, and also show so much.
Me na me wo honomo e wo this hospital honomo. I was just in the crowd because ye say your president no
pass obeji vaccine
no. And I was trying to say quiet in oji vaccine no. And you know, that shows say or GD scientists now emano advice na ye nim say eye adwuma ye nim say ye president on pania I will not support it because that's my president and no cry as I'm speaking to you some presidents have not taken the vaccine.
Really?
Yes.
Body boba konenche.
Liberia. We the year now check it.
Okay.
Yes. But and also is one of the things said you bet me anya nimdie but say leader no ni on believing that we should make sure say knowledge na e wo hono no who at the individual level no you know more and take a decision. But what it taught us is that leadership is important.
Yeah.
Leadership is important. The other thing we also learn say across the world no. Say what nya experience with how we deal with these kinds of epidemics no. The next time bibi beba no. I'm not talking about the human body. System no. But we say now why a fast kakra we debate first no na me adwuma wo UN. That time no Ebola 2014 na UN system na mi boa my logistics ni Liberia, so I was there. And then Sierra Leone Zima, you know, you know. And my year training a lot of people. And my year preparation say Ebola eba Ghana. How we are going to respond? Trainings along the coastline. Sad no a boy time of COVID by because contact tracing need all those things. It was very easy. Say your ministry, ni your Ghana Health Service, ni development community, you bet to me, I'm mobilizing nipa. When you have a health system, no, I say you should be investing into it, into the preventive measures. You have to, so that say bibiba, you'll be able to quickly respond to it. Oben say recently, no, Lassa fever. Problem be Marburg and others. But we say yeah Ghana Health Service very fast because surveillance systems need investments kakra throughout the period no eboa. So COVID-19 pandemic no it tells us that debia no say yen koso na then ye strengthen your system no so that if anything should happen, any pandemic should happen again, no, we can be able to respond to it. And the lessons, you know, there's a lot of lessons. We've learned during the period. Then I would like us say for everybody listening, should not see only the verses now echo your arm, but then who say. Pandemic no man some lessons we have to learn and for me one of the key ones is the use of the mask. use mask.
Yeah.
When we say,
and I think say hand washing and running water also
exactly was also
one of the best. I think we should continue with it.
Yes.
So the vaccines that we are using has been found to be efficacious. We now know they work because Yinaya will be, and sometimes no be who's
my second booster.
Why your second booster? Is it allowed?
It's allowed.
Really?
My country program manager said me second booster.
Okay.
They said my one second booster.
Oh, really?
I'm serious. Yes.
Okay.
Yes.
So what lesson can we learn from
full dose? And me third me booster no. Moderna. And
our Pfizer. Oh, the what you need
because me took quarantine per se.
Okay.
Say or mama kwan say obetumi year with second booster no
OGYEI.
so be a booster.
Yeah.
It's very, very important.
Okay. So what can we no mean booster say? Does that mean say like need its potency all the time? Yeah, na coffee mana.
Oh, if you say yes, a bet to me a coffee, but for now no. Those either Johnson 1 no, and AstraZeneca
as the primary series.
As the primary series no. Go and have your Pfizer booster. Very important. So that
now people because a bit me as go for second booster.
Yes, after the period, the series are there.
But no my nyina baby fa ko say one more person no enwo na omo ma wona na say wanti no.
But I can tell you say a lot of people are getting their vaccines now. Say I told you Western of time I started na Ghana Health Service for yet now say you share the beer coverage no one na enye kra. Say is around 63% fully vaccinated.
Wow.
Yes. And we are getting more and more and nationally no and I say Friday here in Penia Odra EPI I don't know shows 56 over 56%.
So getting to the 30% now year panel.
Yeah, 56% of the population of the 80 million. I say around 80 million. I say see, we are getting gradually there. It's difficult, but we are doing better.
Okay. So now me question say the vaccines that we are using has found to be efficacious, and you and I can attest to it. It's really working. So what lesson can we drive from its manufacturing? Then we come to the deployment.
This is a very important question. So one of the lessons are what we have learned is that say a pandemic be bad. On say vaccines, at the beginning, the countries that have a lot of money, the US, more committee resources to the manufacturing companies, AstraZeneca, Pfizer, especially, and Johnson & Johnson, and then AstraZeneca. These are companies they invested into the vaccine. Now, my friend candidate vaccines. They say they experiment now. They say 80 candidate vaccines now. Yesterday.
Okay. But like the trials.
The trials. And a movie who say, "Sa 3 or 4 years you see, and no never to me." The outcomes now. One of the lessons that manufacturing is you need to pull money together so that say pandemic no bar ube to me quickly give it to the manufacturers to act because on say omo businesses enti omo no much is just say me meye weni their priorities enti upe say no all stop it ni first priority no don't call yet yare buy ejuma no you have to pay to make sure say we call it the opportunity cost the alternative now be kwa yet you have to take care of it and the US the government would say ejuma JSI USA a lot of money into it and that moved the manufacturers to focus to let us problem. If you don't put money in it, omono or your businesses.
Okay.
So that is one thing. And say yentuminya sikabi wo honuma se bibi ba. You bet me I can say, hey manufacturer, stop all this and now we want to say you should focus on this.
Yeah.
So that's number one. Number two, patent. On say who discovered BBA.
Yeah.
Process B and now why trials B and I say BBA won't say AGYEI jima. Emra is like a woodia. At a company no and as scientists no. And so obi ewo baby or no or factory crowd or bet to me produces ade no. Wontumi farmer no say go and produce because I didn't know it's under patent. So here senior the structures in the world were at that time you know. We have to do a lot of work. For example, AstraZeneca, AstraZeneca company, you know, and a start here and a sa vaccine. But near yedi ye juma wo Ghana no, na Serum Institute of India, and a producer here.
Okay.
Now to allow Serum Institute of India, say better to me a producer here, there was a lot of discussions, and it's a CIA can. Across the world, no, there can't framework be one same as a CNO so that when we have a pandemic, no, you bet to me, I'm making sure that it's patent, you know, a quick for different manufacturers now more infrastructure. I bet to me, and they are producing vaccine like Serum Institute of India, one of the biggest vaccine producing giants in the world. No, I bet to me, I am tempted. Then another thing I say Africa. Now, we don't have any vaccine manufacturing but South Africa, some time ago now, I went there, I trained under their vaccinology system. That time, that was at 2010. Now, more will be to start with. So, we say Africa needs to come up and have some few plants. You bet to me, they manufacture vaccine. The event say we need to produce some so that we invest into those things. So Senegal, you know, they have some things coming up. I know that different countries, including even Ghana, you know, there are discussions. I don't talk for Ghana Health Service or the Ministry of Health or the, but in the development community, and him say, it's our effort we are a vaccine institute to see what is possible. It will take us time, but the lesson here is say, Africa should also mobilize. I know to be ready. Say infectious disease are high in a pandemic should come. At least say to me yet try no. You bet to me feel and finish.
Okay.
Feel and finish is say sa isuni wahan. And you mean to me producing soon.
Yeah.
But it's you kasa. But say me to me ingredients na me to me up packing na ma silly na ma yeno. Good to go. No, it's very important.
Can you explain that again?
What I'm saying is, say to me, manufacture issue nankasano.
Yeah.
Vaccine nankasano.
Many young na.
But ye wo factory a bet to me anya ingredients no. Nya ye research no ho ye ready no. Ye bet to me anya ingredients no. Na ye di ye be pack it. We'll package it like this. So that the plastic need a cover, need how they be sealing it bibiano, you bet to me. It's very, very important. A lot of drugs are sometimes in countries like Ghana, no, feel and finish. When ingredients no, now you feel and finish. Even at the Serum Institute of India, no, original products no be. They get it from outside. But they have the infrastructure.
They just package it.
Yes, in some of them they have the infrastructure because patent, you know, now you're signing some bet to me you see. Now you're there.
But send the Kagana bit to me, also I say.
It will not be a sudden flight.
Oh, but secondly, you see much. In independence, this is celebrity there. Is it 67 or 66? Independence, no, they. You see much, Anna.
Yes.
Independence, right? In South Africa. Anna.
Of course. Of course. So, yes, Mamika said Ghana ye won in India kakra so ye betumi. It requires a lot of preparation in Yama.
So have you thought of that? Have we thought, because as a public health scientist, have you thought of that?
We have. I can tell you, say, a lot of training, a lot of discussions. Now, ye wo nipa omoye Ghanaians omo manoni. They are outside. Once the system is ready, so it's not an easy thing to do.
So can we start from somewhere? That's what I mean.
I think the process has started because it's here. There were committees are there.
It's not about committees. There
are things going on. For example, the Vaccine Institute. I don't know. I can say I'm not speaking for government or this, but I know, say, the plans are underway, and let's all have faith.
It's in the pipeline, as they usually say. But pipeline, they make you matter to all that.
So we have made progress. Now first, the thought was not there at all, but we are making progress. Say, you bet to me a drew time, even feel and finish, and now say you bet to me this, and we have contributed to many trials in the past.
Okay, so Doc, let's talk about the deployment because of time.
Okay, and so in the deployment, so we realize a number of things.
Okay,
one of the things I hear at JSI, there were big immunization center, were USI across 7 countries. Yeah, who say, we no start here, na only training of healthcare workers and the vaccine. Senior, we will just push the vaccine into the arm.
Yeah.
And your communication, your communication around the vaccine to make sure, say, those who will receive the vaccine, they will get more information and get more and more information along the line. We should have pushed the communication ahead and carry in the vaccine. And that is one of the deployment lesson now we have actually learned. What it means is that a lot of hesitancy.
Yeah.
Yes, because on say vaccine, COVID-19 vaccine.
Yeah.
It was not for children.
Yeah.
From the beginning. Now some countries 5 years you can get 5.
Yeah, in Ghana, so I think say 15.
15, yes.
Yeah,
but in the beginning, it was for adults. Now adults also there.
When you're used to cross say adults.
But children,
hepatitis B, as I mentioned earlier, I want to say there are vaccines they just go for it, like Hep B vaccine.
Yes, but you see, in the beginning, all households now, your children. They don't say anything.
Yeah.
They are young. They just go and they get the child.
Yeah.
But for adults, they think about so many things. And then there were a lot of myths and then misconceptions and disinformation and misinformation are occurring. So that created the problem. So we should have moved ahead fast with communication.
Okay.
Ahead of the actual jab. But we didn't do that that is one finding that we so yes, in deployment, let's move ahead with communication to deepen understanding of communities and members to know.
And in the aspects of COVID, I think one of the things that Ghana had say, education. Yeah. And sometimes say, and you say, may can't be a Juma, and I say, I'm just wondering what the health promotion people in Ghana, what they do.
Yeah. I think it's all of us. I think that
but I'll say. You can't just say health promotion, you promote health, but you just sit down, you draw policies, and the implementation we don't see.
Yeah. So what I can say is prioritize the promotion of health. There are aspects I want.
I say curing parts no. The snake say you promote you be primary prevention or you focus in the whole.
So we need to we are changing.
We are changing it.
We are changing.
We are on our way.
We are on our way.
Changing
gradually, more small. Okay. To make sure say this. There's one thing there, if I may add. There is also commercial marketing. Senior. Young private sector and commercial we better on be there is an aspect your friend social marketing.
Okay.
Enu de upe say nipa no, you should do it for social good.
Yeah, I think so that Dr. Atakwa mentioned what happens.
Yes, it is. That is an aspect I say health for you better me promoting.
Yeah.
So that you the population who what technologies are there?
Yeah.
What treatments
and
are
they
there?
should also use health people to do those things, not to be or thing change to do it. Because what is coming from health person, onim the worker. Dog, you are laughing, but it's true.
It's true. So yes, sir. The other thing that we need to put in more resources into that area. Because first, resources now this share area now it is not, a program now we are doing with you. You see that we have been consistent throughout.
Yes.
Because you focus here and you say
Ejuma is working.
It's working because of the listenership
Yes.
and the way I hear microphone from those regions.
Yeah.
So you are right. We need to put more. And the health sector, we have a problem. Senia, from the beginning, you restricted the way we talk.
Yeah.
The way we say things.
Yeah.
Even when you want to tell somebody about where you can get services, now you were restricting. We signboard, you were size. We are moving away gradually from that, and we have the health sector have to push and act so that we will do a lot of marketing to tell people what is available to solve their problem, where they can get it solved, what specialists are there, and where treatment is, and all those things.
Because
so that one,
most people are sick out there. You can't like herbal medicine that they are on TV, they are on the radios every now and then, 24/7. Station be you get them. TV be you get them. But why are the your friends say health you don't see them. And when you even try say one kasa hey, the frustration that you go through and some kitwa, then you become myself. Okay, so let's talk about the uses.
Me and some of the telemedicine,
yes.
I have to tell them, say, they have to go to some special places where they can get access to some type of investigations. Now, they didn't know. So we have to do that. Even Uko young health facilities, elsewhere, Uko no to me kind idea, Ubenya leaflet.
Yeah.
It teaches you about what your problem is. Diabetes, this. Facility now. Apart from the video, TV now, leaflet to me kind idea. So we need to do more. And see, I agree with you. So deployment, and we also at the community level, we need to involve the community more.
There are so many a year we'll see a touch one, but you will see a far phone call. So can the uses like the lessons that we've learned with the vaccination, the uses then we take
one of the yes say vaccines be one side effect. Now say side effects now, even the serious side effects say you can like the blood clot thing that you mentioned. Say you who say it to me happen, but it's 1 in a million. It's a year, and when it happens like that, we shouldn't hide it. We should talk about it. Because you who say sad, hesitancy echo, so it was health among healthcare personnel. Yes. You say, I was helping people to understand that better because a lot of doctors free now or more can one but who him there now they are explaining say adi way no say and this is how it happens, this is how it will be managed to create. But so yes, the uses. We also saw say if you are communicating about the use, try say no simple for the community. And then the community can come along and be able to uptake the vaccine.
Okay. So phone lines be activated. We who say numbers in be scrolling our TV so now a question be about the about COVID-19 vaccines and its deployments now busa any issue about COVID-19 any vaccines no busa. Dr. Pedi Power Hanum, so a public health scientist obehu na watimi atro and ask one answer to your question. Intini phone calls and say who ya obetimi afre dog. My in terms of the lessons learned in Ghana and Africa about these pandemics like Ghana, say baby, are we ready?
A bit depending on what it is.
Okay.
But what I can tell you, say across the world, you know, the global health security framework, strategies, we have the countries have done it.
Okay.
And no, onya some information arranged in a particular manner. Say BBC, what you can do.
Yeah. For
example, on say that time the government came up with restriction policies.
Yeah.
Nipa and to me movie here and there. See how global health security framework need so many other systems that are being put in place. It makes us to be more and more ready. In this country, a lot of people have been trained.
Yeah.
Some investment had gone into structures. Like I mentioned, say, when Lassa fever came up, Marburg, surveillance system, had to be picky. Yeah. U.S. government and through CDC in USAID, investment kakra together with the Ghana Health Service, the government of Ghana, into what we call the epidemic, the EOCs that where you bet to me a share say epidemic piba senior you bet look at it and take.
Hello.
Okay.
Hello.
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 Good afternoon.
Hello.
Hello. Hello. Good afternoon.
Yeah, good afternoon. Pacho, did you say that casa free?
Pacho, me casa. Your friend Joe, me casa from Dodoa.
Okay.
Pacho, we my friend say, oh, it's about health issue.
Okay.
Then on the most of the health programs when you go to foreign countries, when somebody is in affirmation, then almost me. Next is to me, so we're back on if to be not a blue hospital. Then next is to me, not patients in Mr. Pana. It is just fair. Send a bit near your pound.
Okay. Okay, yeah, that's a panel question or sir. Okay. Yeah, so. Yeah, you can. We'll be back then.
Yeah, thank you very much for the caller. I think, sir.
Okay, when we are done, then we take the questions and then.
Okay. So, you see that we have made some investment, and it will depend.
Okay. Hello.
Yeah. Hello.
Yeah, Pacho, did you say that casa free?
Oh, well, from my professional work.
Okay. Pacho, what's the say? Okay. Low TV. Low TV, no near casa. Pacho, low TV, no. Pacho, you ain't me fan. Okay. Me casa me Pacho say ofra. No low TV, no. Near TV casa. Ofra ya no low TV. No bet me cry mute, no. They're making beer. Oh, bet we are. No, I could see feedback, no. With TV, no. So, Mr. Mufra, because when low TV now they're making no bet no way. Won't me emba. Conversation in flow into so Freya no low TV and I know mute in the cry. Madam was okay, hello. Hello. Oh, Kafra Safre. So it's not swatching. Hello. Hello. Okay, no, you're tossing.
We have made some investments.
Sorry. Hello. Hello.
Hello.
Yeah, hi. Pacho, did you say that casa free?
Yes, sir.
Okay, Pacho, simple son say. What's say? Hello.
Hello.
Yeah, it's on call. What's say? Aye.
And I mean, we say, maybe vaccines, they are having vaccine for HIV. How is Ghana improving on that? And I'm betting, but maybe Ghana to be someone on those.
Okay. Okay. That's a panel assembly so busai. You be you one koswanishe. Hello? You taking note? Hello? Okay.
Yeah. We've done, it's meant to make us if a pandemic comes, we'll be able to take care of everything. But when we say, we have done some work.
Hello? Hello, TV no cry. Hello?
Hello?
Yeah. Panaka se free.
Look at that.
Okay, Pastor Sambusani say.
Maybe next. Look at that.
Okay, so free techie. Oh, yeah, that's a pa. Pastor Sambusani say.
But the call,
Okay.
because the call, and you coordinate and finding it. And it's a camera by but the room that we must
Main tell Cassani to below TV no so that echo ne be coffee me at the work no. Oh, so what's your whole TV ne so I guess I make a say answer no what. Hello? Okay, I'm another caller. Hello? Okay. Hello? 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 Yeah, Pacho did this and I can say
Good evening.
Pacho low TV near Casa. Hello?
Hello.
Yeah, Pacho did this and I can say free.
Hello.
Hello, Pacho did this and I can say free. Oh, bossy. Okay. Okay. Oh, here booster. Okay, that's it. You be you assemble sana no ama. Me patch us some ofra. Ofra no low TV. So one low TV na. Na yenya noise bebrebe o. Ma just say me kasa we so ansa na what nti yesremo. Eye da bia o. Once I'll be so person ofra no busa question nko ade. Ofra ya no low TV. Ada normal circumstance. O sen ka yidi kan peke wa ha no say. But I think say this system no nti no ofra no low TV na my na etimi aboy. That's it.
Okay.
Hello? Okay, we any hold here.
Okay. Maybe Mamani
Questions
three
now.
questions.
Sure.
The first one is the one who said the healthcare worker, you know, idea I'm sure the ministry and the health team are working on because provider client communication very important. I don't know the particular circumstance, but if you go to an emergency point, you know, Ebiana, the total number of people I work on no more, number of healthcare workers I work on no more. Near my work on my somebody Ebiana wheelchair cry is not there to be able to move the individual nowadays. So near my be brave to me see and then there's something I say will help to I don't know the specific circumstance and the place I was saying, but I think that is an aspect of our healthcare. Here, those who support emergency services and receive patients before they are stabilized now, we can improve that area. The other thing I mentioned about HIV vaccines, we don't have a vaccine for HIV now.
Okay.
But
hello? Hello?
Yeah, we don't have a vaccine for.
Hello.
Hello, Pastor, this is an acasapri. Okay, Pastor Sambusana say.
Pastor, any COVID panel on my office one.
Okay.
Do not meet the second one, meeting warrior. Will it have any effect on me?
Which one did he? Which one did he?
Okay, don't be such a day in our war.
Yeah, no, I need the CCR, meeting Kai.
Okay, COVID now, say. But what card now do I know? Or card no?
And the card no.
Okay, that's it. Don't be you assemble sound. I'm saying implications view one.
Yeah, so HIV, no, we don't have a vaccine, but there is a lot of research.
Okay. Hello.
Hello.
Yeah, Pastor, didn't say Nakasa free. Good afternoon. What did he say Nakasa free? Okay, Pastor, assemble sound. Say. Okay. Okay. That's it. That's a parcel free.
Say there, here,
Booster.
Yeah. And we don't have a vaccine for HIV.
Okay.
But there's a Hishemo Kosoa.
Better way I can maybe say enche and is it that you who say HIV no who here and I say who sad compared to this COVID. COVID by an age now so yeah vaccines. Okay. HIV has been there for hello.
Hello.
Hello, yeah, Patroni is a casa free.
Don't give me fun. I cannot teach.
Okay, say free, Teshi.
Pastor.
Okay, what's some Busan say?
Pastor, COVID vaccination. Pastor, you want Pastor my demand.
Also, why am I the other? Hello? Okay. Okay.
Yeah.
No,
HIV, it's a different story. Yeah. The complexity of the virus.
Okay.
That's
last caller.
Okay.
Hello. Okay.
So how complex it is, no?
Hello. If I last caller, maybe it's here. Hello.
Hello.
Yeah, Patroni is an actor free.
Yeah. Good evening. Your name is Steven Apple.
Okay. Yeah. Hi, Steven.
Yeah. I'm very much Apple. About media. So, education, you know, so feedback we are reaching a lot of population.
Okay.
And really, about so airport. Now, what you are, Dr. Midai, so I say, that as a half so you saw, you're going to give the amount of 290 and what COVID funding.
Okay. Yes, yeah, that's a parcel free. I appreciate the area.
Okay. So briefly, HIV is the complexity. Okay. That's the main thing. And then you have to be investing a lot of money. And a lot of investment have gone into it.
It's not because your way journey so into Avasana.
The nature of the virus.
Okay. Different type. You make us about HIV. Okay.
Right now, will be called neutralizing antibodies. New way of to say vaccine, but it's because of the
because I also can't be in a manner also no. It's
because of the nature of the virus.
And also
so you need vaccine.
Okay.
The one that has the AstraZeneca no. On-call the health facility.
Okay.
Unya AstraZeneca, you know, you get to me about Pfizer. Now I mean, you get the booster for that. Now, Obisa say, should he get the booster? I would strongly recommend he should get a booster.
Okay.
Because Emma, a kanya no. Now you can be able to deal with if there should be, you know, contact. Okay. You know, in it. So boosters are very, very important. And the one who said he doesn't even know about our card, no. The good news is that card no.
Okay.
Or the card no bar eco facility now. They will be able to know, say, oh.
Yeah, because the dinner was so.
And Mestre pass. One of the lenses that steady, rural areas. Unya card now, take a picture.
Okay.
Unya card now, just take a picture of it. Say,
front and back.
Take a picture. So that, say, it's lost. Who bet to me, who call Ayarisabia, you can show it. Then they will know what data we had your vaccine, what type of vaccine, and then they can give
and
you.
I'll be super say time. No, say they have COVID-19 vaccine more more demand. I don't know. Some more be more demand. Yeah.
Not really, but we make sure say when you get it, you will have more antibodies.
Okay, so to wrap up, remember, as a dog, recently I am so a chief of party, but you see a some a country representative of GSI.
Oh, am I
congratulations.
Would surprising?
You can't say I
don't like talking about myself.
Big congratulations, yes.
But I mean, it's just a continuation of our work.
Are there differences? And I say, we jai back, how does it work?
Chief of party say Project B, the director and the boss. USA designation.
Okay.
It's a big project. You know, I'm the boss of the director, but the country representative. You know, there was several projects in our country. You know. And maybe there's a need to talk to JSI by government, and I said, they will talk to me about it. And I also say we'll have to bring more resources to help the country in negotiations, all those things. So basically, it's the continuation of the work. But yeah, so thank you.
You're welcome. I think it's me and your questions, no, but your time so but I mean say so now pay the lessons, pay the resources are more pushing to COVID-19 vaccination for people to take it now. How do Ghanaians perceive the vaccines now? How do they see it?
Good news. Some things have changed.
Okay.
In some of the communities, there is better understanding.
Okay.
You were Western North or halfway in Western, you were groups that are myth busters. You training one almost more capacity, and they can talk to you to bring down your hesitancy and then make sure that we know. So it's improving, but we have a lot of work to do. Even among healthcare workers. 5 days ago, my colleague Dr. B. Person to coin. Or Bisa me say, the person or vaccine, because
all to coin.
So we still have some work to do, but we have learned ways you better to me manage hesitancy. And for me, I know you're one of the very important ways. Your strategy be a friend of human-centered design. And I so individual or no better to me. Get through the process to know that he or she will have to take the vaccine. And we are doing that, and I think that we haven't done badly, but still hesitancy is there. But we have made a lot of progress in terms of reducing hesitancy, tackling hesitancy, even among healthcare workers. So one of my is to deal with our medical colleagues. Medical association colleagues, doctors, and some nurses are now more hesitancy. You see that we have done a lot to bring down it, but it is still a problem. So I will just...
so Doug, yes, you'll take home, so that, and I know
what I would say is we should continue to strengthen the systems that we have, so that in the event that there will be another problem, another pandemic, we can be able to be better at responding to it quickly. I'll say we should continue to get our boosters. Please, still one year vaccine. You are. Then we are leaving you behind. I've got my second booster, so I'll treat all of us to get our vaccines, COVID-19 vaccines, and then make sure that we can all contribute to the herd immunity, so that if we should get another variant coming in with our herd immunity and a lot more people immunized, about protecting all of us. So thank you very much.
Thank you to Dr. AGYEI, a public health scientist, chief of party, USAID Care Continuum Project, and AGYEI. Omo, and a mama hokeka program you come with twice until you don't want to be some mobile support to your ma COVID-19 vaccines updates every week. Dog, yes, here we. And I'm
Yeah.
I just said that okay. Because apomode on semono ehiambo obi ade bia meka say wo sorry na woni apomode won't mean your hwe, but people don't take it serious. Say the adidi agono money je ho, but so sorry na the odi agro ache on the kwan ne ho nya won't me bam bidi agro no. But ni nyina ya can still as in sponsorship so ba na enu ye so a ye wo honom okay baby a ho ni betimi di akwadu ni ekodura na ya san ye chini abeda. Okay, so we can you said this program is supported by USAID Global Bus Initiative through JSI Care Continuum Project implemented by Ghana Health Service. This program is supported by USAID Global Bus Initiative through USAID Care Continuum Project. JSI collaboration with the Ghana Health Service. Or more and a boy my program we say bro. I think someone support here for a while. Hands in the massive panel that Dr. Henry Nagai. So I think it's JSI for Mr. Richard, Mr. Derek Munina Yedamwas, Semo boy ma. This opportunity to work with you on COVID-19 vaccination. Dog, I think it's only last week we are not we are done.
Yeah, our colleagues
okay.
The health sector, fantastic people, and the communities and civil society organizations are we are contribute here, and you too. Great synopsis. Will be some very difficult questions. So we'll be looking at it and we'll continue to support the health sector. USAID, NIA, the funder for the sponsor for all the programs that we implement, especially this one. But let me also talk about Gavi. Gavi Ejuma different countries. This in Ghana as well. So everybody, we thank everybody who has supported our programs.
Okay, Wontumi TV program no your Star Health Talk. Me din the AMPOFO na se be come production here. Mr. Christian, production manager, Nana Kwame, na Pure Glam, na AGYEI Designs, na the makeup no see a friend the Glam Hub or no any makeup materials for your star closet. I ain't no ye do be see how no say nyame adma next week. Nyame adoma ye be say she as bibi nsia ye be say she won cry near their program no. But that's so Jim make sure your Star Health Talk. Bye bye.